So if we determine that a patient needs homeopathic treatment, we'll spend a 2-hour interview detailing how their disease is manifested by a set of symptoms. Our understanding of health is that symptoms are actually the ally of the patient. They are what tells the patient that there's something wrong, that the internal clock is not functioning properly. So we don't mask those symptoms, we use those symptoms in order to establish a remedy that the body will be able to use to heal. So our long interview is actually part of the gathering of information to find the specific remedy that will turn this around and allow the body's balance to come back into order. It is different than when we use our prescription rights to write a prescription. There, or an allopathic prescription, there what we would do is look at the disease and give a drug that treats this disease. But it's not actually a treatment. It's the symptomatic treatment of that disease, but it doesn't change the internal clock. The person still manifests internally this disbalance. What homeopathy does, it offers another approach. It looks at the symptoms more like a detective game in order to find what remedy actually addresses the core so that the person becomes healthy. So that's sort of the aim with homeopathy.
It's very important that we know the essence of a patient's nature. And the reason for that is there is the danger that if you treat on these superficial levels, you can actually suppress symptoms. And here's an example of what I mean. If you give someone a cortisone cream for their skin eruption or whatever, that skin eruption is the body's attempt to try to tell the world around them, the person, that something is wrong. And that, in modern medical terms, could just be construed as inflammation. But however you see it, if you are suppressing that inflammation, which is what cortisone cream is doing, then you are basically pressing that down under the surface. It's not going away, it's just the manifestation of it on the skin is going away. But that inflammation is still going on somewhere in the body. And that whole process, whether it be on an energetic level or a physical one, is going to manifest somehow.
How we have the repertoire that we have of remedies is that each individual remedy has been tested by an individual or individuals taking it and recording every single symptom. So there's a full pharmacopoeia for all the remedies given. And the art in homeopathy is the matching of the symptoms that the individual manifests in their state of dis-ease to what the remedy produces in a healthy person.
It's like the disease is a maze and the remedy is a map. And if the map doesn't match the maze, then there's not going to be any way for you to get out of it. But if it does, then you can find your way out of that maze.
And so by matching the symptoms ABC that the remedy has and can manifest to what the individual patient is experiencing, we have a fit. And that fit, that match, is the basic rule of healing, that like cures like. A patient would ask for homeopathic treatment usually after they have tried numerous ways of dealing with their diseased state. So whether it's rheumatoid arthritis or MS, or whether it's chronic gastritis, or any symptoms that they have used drug therapy for that has possibly helped or alleviated the symptoms, it hasn't really changed the root of the disease. They still have the diagnosis, they still have the disease. And it would be at that point that, and especially as the body gets used to drugs, you need to have stronger medication. And medication, though it can be extremely helpful, also has side effects. And then usually they're on several drugs and side effects of those drugs. And at one point, people feel like they need to try something else because they're getting sicker and sicker. And that's usually when they'll come to naturopathic doctors, and that's when homeopathy particularly is very helpful, as it will allow all the symptom manifestations to be addressed individually, and the person will start to reverse the actual disease process. It is not an easy route in the sense that it's no quick fix. It is an engagement on the part of the patient and the doctors in the clinic to follow them up and make sure that the treatment is going in the right direction, that there's enough consultation to be able to address the changes that they're experiencing.
We have to be so knowledgeable, and we have to undergo such rigorous training. And that is the key difference as well between just going to your pharmacy and picking up a combination homeopathic remedy, or in fact some practitioners even work on this combination homeopathic approach, versus what is known as a classical homeopathy.
Well, in the 2-hour interview, we really need to know that individual. So it's not just getting the chief complaints down and how they manifest. Let's say it's rheumatoid arthritis. So we would go into the details. Well, when is it worse? What time of the day is worse? What makes it better? What makes it worse? And you'll see that all rheumatoid arthritis cases are not the same. They have individual manifestations. So we'll take a very thorough history of all of that. But we also will be asking questions on what foods that they crave instinctually. How do they sleep? What types of dreams? What position they prefer? What fears do they have? How do they express their emotions? What's their personality like? We really need to match the whole person with a remedy that manifests a whole picture. Because all these drugs, whether they're herbal, animal products, minerals, it doesn't matter, produce a full set of symptoms. Not just physical symptoms, they produce emotional symptoms as well.
I prefer to allow the patient in this individualized way to again lead me wherever they're going to go. A lot of times I actually might seem stupid because the patient might be like, well, you don't know what pain means, or you don't know what a headache means or something. But when I'm prompting them in that way, I want them to tell me more about what it means to them, because that is the biggest mistake we make in medicine today. We assume we know what they mean when they say they have a headache. We assume we know what they mean when they have a skin complaint. Whereas in actuality, we don't necessarily. We just have our own preconceived notions that we've learned from books, that we've learned from our past experience, but which may not apply to this patient.
When we take, for example, the use of Ritalin for a hyperactive child, if you give Ritalin to a non-hyperactive child, they will often produce symptoms of hyperactivity. The reason that it calms a hyperactive child is because it's similar. And that concept actually predates Samuel Hahnemann. It comes from the 5th century philosopher Paracelsus, who noticed that this is a natural way of healing. And Samuel Hahnemann actually is the one who turned it into a medicine and made use in the 19th century of all the data that was collected, in the long, bloodletting and arsenic poisonings and mercury poisonings. And so we have a lot of the heart medications actually come from the medical physicians at the time who recorded this incredible data. And so homeopathy was developed at that time. When a person receives a remedy for, let's say, back to the rheumatoid arthritis, it will also change their sleep problems. It will also change their their temperament and their mood, because you cannot aim at a disease. You aim at the whole person. It is a whole person treatment.